Hepatitis A, HAV. Hepatitis A is a type of hepatitis that results from infection by the hepatitis A virus, HAV. This is an acute, short-term type of hepatitis, which usually requires no treatment. According to the World Health Organization, WHO, 1.4 million cases of hepatitis A occur around the world each year. In particular, this highly contagious form of hepatitis can be spread through contaminated food or water. However, it generally isn't serious and usually causes no long-term effects. A hepatitis A infection usually goes away on its own. Causes of hepatitis A. People develop HAV infection after contracting HAV. This virus is typically transmitted by ingesting food or liquid contaminated with fecal matter that contains the virus. Once transmitted, the virus spreads through the bloodstream to the liver, where it causes inflammation and swelling. In addition to transmission from eating food or drinking water containing HAV, the virus can also be spread by close personal contact with an infected person. HAV is contagious, and a person who has HAV can easily pass the disease to others living in the same household. Specifically, you can contract hepatitis A by eating food prepared by someone with the hepatitis A virus, drinking polluted water, eating food handled by preparers who don't follow strict hand-washing routines before touching food that you eating sewage-contaminated raw shellfish, not using condoms when having sex with someone who has the hepatitis A virus, coming in contact with hepatitis A-infected fecal matter. If you contract the virus, you will be contagious 2 weeks before symptoms even appear. The contagious period will end about 1 week after symptoms appear. Symptoms of hepatitis A. Children under the age of 6 typically show no symptoms when they contract the virus. Meanwhile, older children, teens, and adults usually develop mild symptoms, which can include abdominal pain, especially in the right upper quadrant, flu-like symptoms, fever, fatigue, body aches, jaundice, yellowing of skin or eyes, light-colored stool, loss of appetite, unexplained weight loss, dark urine. In particular, symptoms usually appear 15 to 50 days after you contract the virus. Risk factors of hepatitis A. Hepatitis A is usually spread from person to person, making it highly contagious. However, certain factors can increase your risk of contracting it, including living in the same household as someone who is hepatitis A positive, living in, or spending an extended time in, an area where hepatitis A is common, including most countries with low sanitation standards or a lack of safe water, injecting or using illegal drugs, having sexual activity with someone who is hepatitis A positive, being HIV positive. The WHO reports that more than 90% of children living in countries where there are low sanitation standards will have had a HAV infection by age 10. Complications of hepatitis A. In extremely rare cases, hepatitis A can lead to acute liver failure. This complication is most common in older adults and people who already have chronic liver disease. In particular, if this occurs, you will be hospitalized. Even in cases of liver failure, a full recovery is likely. Very rarely is a liver transplant required. Diagnosis of hepatitis A. After you discuss your symptoms with your doctor, they may order a blood test to check for the presence of a viral or bacterial infection. A blood test will reveal the presence, or absence, of the hepatitis A virus. Some people have only a few symptoms and no signs of jaundice. Without visible signs of jaundice, it's hard to diagnose any form of hepatitis through a physical examination. When symptoms are minimal, HAV can remain undiagnosed. Complications due to a lack of diagnosis are rare. Treatment for hepatitis A. There is no formal treatment for hepatitis A. Because it's a short-term viral infection that goes away on its own, treatment is typically focused on reducing your symptoms. After a few weeks of rest, the symptoms of HAV usually begin to improve. So, to ease your symptoms, you should avoid alcohol, maintain a healthy diet, drink plenty of water. Way to prevent hepatitis A. The number one way to avoid getting HAV is to get vaccinated against hepatitis A. This vaccine is given in a series of 2 injections, 6 to 12 months apart. In particular, if you're traveling to a country where HAV transmission is more common. To greater than get your vaccination at least 2 weeks before traveling. It usually takes 2 weeks after the first injection for your body to start building immunity to hepatitis A. If you're not traveling for at least a year, it's best to get both injections before leaving. Also, check your destination on the Centers for Disease Control and Prevention site to see if you should get a HAV vaccination. Moreover, to limit your chance of contracting hepatitis A, you should also drink bottled water rather than local water in developing countries, or in countries where there's a high risk of contracting hepatitis A. Dine at established, reputable restaurants, rather than from street vendors. Avoid eating peeled or raw fruit and vegetables in an area with low sanitation or hygiene standards. Thoroughly wash your hands with soap and warm water before eating or drinking, and after using the restroom. Positive information about hepatitis A. With rest, your body will most likely recover completely from HAV in a matter of weeks or a few months. Usually, there are no negative long-term consequences of having the virus. After contracting hepatitis A, your body builds immunity to the disease. A healthy immune system will prevent the disease from developing when you're exposed to the virus again. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.